Hi, it's Dr. Sweeney back again to talk about another medical subject. Now, today we're going to talk about anxiety and depression. It's a really common condition that I often see a lot in my day-to-day work. It's something that can affect anyone at any time. If, as humans, we're put under enough stress, anxiety, worry for a prolonged period, it can start to make us feel quite anxious, quite panicky. We can't settle. We get anxious about doing things, going out. We want to stay in. We have a fight or flight reaction where we want to escape situations a lot of the time. This can gradually sometimes wear us down. We can become more depressed. Depression can be quite subtle. It's not necessarily someone being really tearful. It can be someone just losing their interest in activities, not enjoying anything they're doing, just wanting to sort of spend more time to themselves, becoming less sort of interested in their own personal appearance. All these kind of things, people becoming more withdrawn, can point towards a diagnosis of depression. And sometimes people don't realize that they're depressed. You know, it can be something that builds up over a number of weeks or months, often, or sometimes years. And it's linked to often difficult situations that can occur in the past, or that's something that's happening in the present. You know, it's really important that if someone is starting to show signs of feeling more low and withdrawn, or you yourself are feeling like that you seek help and you talk about it, especially to friends or family that you really trust. Speak to a medical professional. There are lots of sort of phone lines and online support services as well. So never be alone, never be embarrassed. You must always seek help and talk about it, because although it's an awful illness, anxiety and depression, it is very much treatable as well, which is really important to remember. What can help treat it? Well, lifestyle measures, first of all, doing a bit more exercise, getting out in the fresh air when it's a bit lighter during the day, although the days are a bit shorter just now. It's really important. Eating healthily, cutting down caffeine, cutting down and minimizing alcohol, which in itself is a real depressant, can go a long way to start to help you feel slightly more relaxed and slightly better. As I say, exercise, picking up some new exercises, perhaps swimming is quite therapeutic and relaxing, walking as well, cycling, just something to get you out and about, and it really does help to help people to feel better. There's online resources as well that you might be directed towards by your GP surgery. A lot of local areas have their own psychology departments, which then have online services as well as face-to-face services. So being referred to a psychology department, depending on the severity of the situation, could be something that could be helpful. So talking therapy is a really important part of the treatment of anxiety and depression, and at times can be as powerful as medication. Talking about medication, there is obviously lots of different antidepressants available. Again, that's a discussion between yourself and your medical practitioner. Antidepressants are there for a reason. You know, if people are really struggling, sometimes they need some medicine to help top up the theory is that the neurotransmitters, particularly one called serotonin, can go quite low in the nervous system in the brain when people are quite anxious and depressed. And a lot of these medicines are based on topping this up. And that can then put people in a position to be able to then do the psychological work to deal with the underlying causes behind the depression. So a multi-pronged approach. The key thing is that you sort of recognize that you're struggling and to seek help and not to worry about seeking help. It's really important because, as I say, it can be treated. So hopefully that's been helpful. Keep yourself safe, and yeah, please seek help if you're struggling with anything. Until next time, see ya.